Good morning, and thank you for listening to WXRA 102.8 AM. I'm Sanithia Grimes,
And I'm Diza Madastin.
and we are Real Talk, and Real Talk is about to get real.
No realer.
We are coming to you today talking about healthcare. We're going to describe the equity and the needs and the relationship it has on the health economy. Now, just in case y'all don't know what health equity is, let me break it down to you. Okay, you know you got the north side of town, all fancy, got all the medical facilities. Anything you need is there medically. Then you go to the south side of town and you can't find nothing but Grady. That is equity. When things are not getting the quite same quality health care due to the different geographic. So this is what we're going to speak on. And we're going to speak on it with the relationship with economy. In the economy, when we talk about the economy, when it affects everybody. Now, for example, actually not for example, to tell you the truth, do you know it's 29 million people that's underinsured and 44 million that's uninsured? Now, underinsured, you almost got it, but you don't have it all. So you go there, you think you can get a little something done when you need some other stuff done and you're not covered, underinsured. And then you have uninsured, where you have nothing.
Zilch.
And when you don't have nothing and you go to a doctor, guess what? You're getting a medical bill. And it's not a little bit of something either.
Those bills are
It's
high.
going to be a big bill because on the average, it costs $8,000 to take care of a human here in the United States. So guess what? You got a large bill coming.
And that's $8,000 per year.
That's a lot of money. So the thing is that what happens is that when people get these medical bills, they end up filing bankruptcy. And do you know 6% of bankruptcy is due to medical bills?
Wow.
And guess who end up filing bankruptcy? You got your middle class and your low class. They end up having to file.
Right.
And the thing is, not only that, the equity kind of hurts them more for the simple fact they don't even have a lot of facility that's being needed. They lack hospitals, they lack medical facility, they lack specialists, they lack all those things where they have to travel a distance just to get the basic.
Even pharmacies.
And the basic is having preventive care. They can't even get that. Or just having your routine annual done like women needs to have. They don't even have the right technology in order to get medical procedures done. They got to travel. So all of these are what we call equity. When there's a problem between one region to another or one population to another. But guess what? That's going to tell you a little something that has changed that has been able to maybe everything finally even out.
Yeah, well, not even yet, but we're working towards that. But since Obama has been elected, he has implemented the Affordable Care Act. And so with the Affordable Care Act, it's helped a great deal through providing more insurance for everybody. Those who had previous existing illnesses can now, get insurance to get taken care of. Those with mental illnesses, those are often disregarded. They now have insurance. And different facilities are added to different regions. So these are all elements that are just going to help with the economy.
All right.
And so when we think about us getting insured, more people getting insured, we also have to think about need when it comes to the topic, equity and need, right?
Yes.
And so what do you consider, what are some needs, huh?
Going to the hospital for no reason. You got a little scratch and you're ready to run
There we
down to
go.
the emergency room. You're ready to go
There
to
we
the
go.
hospital and see you have broken something.
That's right.
Just
so if
because
you
you
get a
got
little
your card.
scratch, it has nothing to do with an MRI and an
Thank
X-ray
you.
or none of that. It has nothing to do with that.
No.
So don't go out there getting things that you don't need.
It's not a plastic car or like a platinum car. It's just basic insurance card.
That's right, because even though it doesn't cost you, it still costs those facilities
correct.
to use those machines. So
That's
you have to
correct.
be a little mindful of those things. Don't go willy-nilly with your insurance, all right? And so also when we think about the Affordable Care Act, you know that it influences different populations, and so that it includes the low income, the middle income, and those who are just poor. And
That
so
must be me.
Right. It's helped the lowest income and it's benefited them the most because they now don't have to pay for premiums to obtain that
Oh, wow.
insurance.
Great.
As far as the middle income, they now qualify for tax credits to help them buy the insurance.
All right.
And those who are poor, they didn't have insurance because maybe their jobs did not provide for it, or their private premiums were too high. And so now with the Affordable Care Act, these things are now affordable to obtain insurance.
So everybody.
So it's for everybody.
Across the board.
That's right.
Equal.
That's right. That's right.
Well, you know what, guys? We got a couple of people who's trying to call in and ask a couple of questions because they want to get real with us, so that's good.
Trying to get real. I
Because
like
that's
it.
what we're about.
Let's
Nothing
do
but
it.
real.
Hi, Diza. Can we request an expansion on Medicaid within our state?
Well, in 2012, the Supreme Court did give states the option to opt out of getting Medicaid, and so our governor of Georgia, he actually did opt out of doing so because he said that funds were insufficient. And so,
I can laugh about that later.
so basically, no, not yet, not for Georgia at least.
Okay, well, we got Teresa who has a question.
Sanithia. What can we do as a community to request more medical facilities?
Okay, get with your community leader. You know, get with anybody that can come together, take it to the county, take it to the state, demanding more medical facility in your community. You don't
Speak up.
just, you know, complain about it. You have to do something about it in order to get all the necessities needed in your community where you don't have to travel for. Okay? Now we got time for one more caller, okay? And I think we got Benita who got something to say. Let's see what Benita has to say.
Hi, Sanithia. Will the Affordable Health Care Act help better our economy in the future?
Yes, it will. It will help better because when everyone is insured and they're doing their preventive care, then it helps not only that person but it helps the economy.
That's right.
Where they won't be getting medical bills, or we won't be trying to take care of someone in a severe state due to the fact they didn't get the preventive care.
could have
So as long
avoided
as
it.
you get to the preventive care, you can definitely avoid a lot of other things that
That's
can
right.
happen. So yes, it will definitely help us in the future.
No more bankruptcy.
No more bankruptcy.
All right.
Now we're gonna sum this up to let you know that get up, get on your laptop, go to the library, get on the computer, look up the Affordable Care Act,
Sign up.
sign up and get your insurance.
That's
Don't
right.
you complain and whine about why you couldn't get it, because it's out there, it's offered for you.
Mm-hmm.
All you have to do is push the button and you can't get no realer than
It
that.
doesn't.
Thank you for
Until
tuning
next
in.
time.
Sanithia,
And Diza.
see you
Keeping it
next
real.
week.